Imagine this, you have a sore throat, but the next doctor's appointment is a couple weeks away. However, there is a nurse practitioner that can see you tomorrow. So what do? Do you book that nurse practitioner? I'm Dr. Karthik Orayappan, and I get asked this question all the time by friends and family because they know that I work with nurse practitioners inside and outside the hospital. The implicit question that people are actually asking me is whether or not they're gonna get good quality care from a nurse practitioner. But in order to answer this question best, we have to go back to where this profession came from and why it started in the first place. Let's rewind to the 1960s. You're living in rural Kentucky, and it's post-World War II, and there's a baby boom. There's also a massive doctor shortage. Your kid has a fever and a sore throat, and there's no doctor within 50 miles. However, a nurse shows up at your door explaining that she's been trained by some of the local physicians. She takes a look at your child, and she thinks that your child has strep throat and prescribes penicillin. This is where the expansion of the scope of practice for nurses began. This filled in the physician shortage gap. Then, in 1965, the University of Colorado launched the first nurse practitioner program. It formalized the training and gave the legitimacy to the work that nurses were already doing that was doctor-like. Most nurse practitioners started in primary care, and most still are in primary care. But now, you'll see nurse practitioners everywhere. You'll see them in the emergency room, in the oncology suite, at the dermatologist's office, and even the critical care unit. In fact, 29 of the 50 states allows full scope of practice for nurse practitioners. This means that they can diagnose and treat medical conditions and prescribe medications without any input from physicians. That is a massive change in healthcare. How did this happen? And why did this happen? Like most things in American healthcare, it comes down to money. The reality is that healthcare systems can bill the same amount for a visit, whether it's conducted by a nurse practitioner or a doctor. But they can pay nurse practitioners a lower salary. It's a financial no-brainer. It's a cost-saving measure, and ultimately it increases the profit margin of healthcare systems. But for individual nurse practitioners, it also means more money and opportunity. Becoming a nurse practitioner means a jump in salary from a bedside nurse. And especially if you go into a specialty field like aesthetics, you can make well over $200,000 a year just as a nurse practitioner. You've probably seen those viral interviews on TikTok where nurse practitioners are giving Botox or fillers and they're making a boatload of money. But the thing is that none of this is new. The same thing happens with medical students and doctors. Medical students prefer to go into that specialist role rather than primary care because of the financial incentives. So this is good for nurse practitioners. This is good for the healthcare system. But the key question is it good for patients? Here's where things get nuanced. On one hand, nurse practitioners improve the access to care. That's the entire point of why their profession started, so that someone can see a provider if a doctor is not available. And when it comes to chronic common conditions, I think nurse practitioners, the data shows, they actually do just as well, if not better than physicians. Say, for example, you have diabetes or hypertension, which is high blood pressure. These are very algorithmic problems. There are guidelines that show the provider which medications to start at what time, how to make the dose adjustments, and what targets to hit. I think that nurse practitioners really excel at this. They are focused and they spend time with patients. When something doesn't fit the pattern, I think that's when the depth of training really matters. Doctors are trained to think very mechanistically. We want to understand the why behind the physiology and the disease. We spend years mastering that science, and we see thousands of patients under supervision. That foundation helps when the presentation isn't textbook. When symptoms don't make sense, or when rare or atypical presentations are masquerading behind common conditions. I think on average, that's where physicians really excel. So here's the advice that I give my own family and friends when they ask me that question, whether or not they should see a nurse practitioner. I think if it's a simple, common, and non-serious condition, I think it's very appropriate to see that nurse practitioner. But if it's something that is a little bit more complicated and that simple is not getting better, or it's more serious, then I think that doing what you can to see a doctor is very appropriate as well. But when it comes to procedures, especially cosmetic procedures, I think the evidence clearly favors physicians. But at the end of the day, I think that the best care comes to be when every provider knows what their strengths are, but also what their limitations are. So I really want to know, what your experiences have been like with seeing a nurse practitioner versus a doctor, and whether or not you think that it's good that they're able to practice completely independently with a large scope of practice. Let me know in the comments below.